In this video, I'm going to demonstrate effleurage to the front of the leg. Effleurage is a foundation massage technique which is used to apply the medium to the area that you're treating, to get the clients used to your touch, and also to warm the muscles ready for heavier pressures which may follow. Okay, the medium that I'm going to use in this video is lotion from Physique. It doesn't really matter which medium you use, this is just preference for today's video. However, you could use oil or you could use lotion, cream or wax as well. Quite often it's up to the preference of the client too, because the mediums can feel slightly different. Okay, we just need to prepare the area that we're going to be treating, which, as I said, is the front of the leg. So we need to be careful with the towel technique and make sure that we're able to access all of the muscle area. So sometimes you might need to tuck the towel in underneath the client's other limb so it's not getting in the way whilst you're doing the technique. During the technique, you're going to be in like a lunge position. You want to be careful with your body position and make sure that you're engaging the abdominals and keeping your body nice and upright. And you're using your legs effectively. So you're transferring your body weight from one leg to the other as you're moving up the limb. If you end up rounding the back and your arms are escaping out too far in front of you whilst you're doing the technique, you're not going to have consistent and effective pressure whilst you're applying the technique, and also you're going to end up with lower back pain, probably mid-back pain, and maybe shoulder and arm pain as well, especially if you're doing multiple treatments during the day. Okay, so the first thing we're going to do is we're going to pop the lotion, okay, onto the palm. So you're not going to be putting the lotion directly onto the client here. A little bit of client care. We're placing it onto the palm, and then from here we're going to warm the lotion up first. Now, the great way of having your hand on here as you apply the lotion means you're not going to have any spillage to the area, and also if there is a very slight spillage, it's just going to end up on the client's leg, okay, rather than on the treatment couch or on the floor. Okay, now from here I've got the medium onto both of my hands. The direction of my hands are going to be like so. So we've got the elbow pointing out in one direction on one arm, the other elbow pointing out on the other direction. And as I mentioned, my legs are in like a lunge position here. Okay, I'm going to start with effleurage to the quadricep area. Now what I'm doing is I'm placing slight pressure into my hands here, and then the hands are traveling up to the top of the leg, and then we're going to come all the way down the leg towards the ankle. Now when we're in the shin region, we've got to be mindful of the tibia bone here and the spine of tibia. So the pressure in this area is into the heel of my hand and also into the fingers. So I'm not pressing down directly over the tibia bone. Okay, so I'm still coming into the muscle. So the muscle that we're treating in this area is going to be the anterior tibialis, and we're also going to be coming into a little bit of the gastrocnemius muscle as well. Okay, we're reducing our pressure as we come over the patella area, and then increasing the pressure again as we go into the quadricep area. And then, as I mentioned, just be mindful of your technique. You're engaging your abdominal muscles to help you to support your back, and you're transferring that body weight from one leg to the other as you move up through the leg. Okay, so again, pressure on as we're coming up, and then we reduce that pressure as we come back down again. So this effleurage technique is following the direction of both the blood flow and the lymphatic flow. So we're thinking about the blood flow through the veins. In this instance, they're traveling back, the blood's working its way back up towards the heart, and we're working in the direction of the lymphatic flow. So again, the reason why we're using this introductory foundation massage technique is to apply the massage medium, to get the client used to the touch, and to warm the muscle ready for further techniques that follow. So again, just to recap here, we've got the hands in this position. So fingers are pointing one way, elbow out towards one side. Fingers pointing the other way, other elbow out to the side. Okay, when we're in the anterior tibialis area, we're applying the pressure through the heel of the hand and also through the fingertips. Okay, then we're reducing pressure as we come over the patella and applying heavier pressure again in that quadricep area. And then we're reducing the pressure as we bring our hands back down the limb. So pressure on in that upward direction, pressure off as we bring the hands back down for another movement. Okay, so this is our key effleurage technique. There's also a second form of effleurage, which is known as thousand hands. In some books and other resources, it might be referred to as long stroking as well. Okay, so our thousand hand technique, essentially again, is still working in that upward direction. Now I'm applying the thousand hands over the anterior tibialis here. Okay, now what we can see is that we're starting on the fingertips and then we're moving the heel of the hand in that upwards direction. And in this instance, we're working up towards the knee. Now, as this hand moves up, the other hand comes underneath it. So the direction is moving upwards. Okay, we're going to do that about 3 to 4 times on the anterior tibialis area. And then we're going to move up onto the quadriceps region. Okay, we're making sure that we're covering all of the quadricep area. We can also include the adductor muscle group as well, which is otherwise known as the inner thighs. Okay, coming out to the outer hip as well. So we're being mindful to cover all of that quadriceps group. Again, about 3 to 4 times. If you've got more time to spare within your treatment, you could increase the number that you do this. And then we're going to move back down the leg. Okay, back to that anterior tibialis. We could bring in the gastrocnemius, but we often will mainly treat that gastrocnemius when the client is in that prone position or face down. Okay, and then coming back up again. So our thumbs are together. And it's a nice, even pressure. Okay, then once we have covered all of that area several times, we then come back to that first effleurage technique. And then the treatment would follow on with your petrissage or your other massage techniques. Okay, so that was a demonstration of effleurage to the front of the leg.